tricky with no lectern. Okay, you let me know when we're good to go. Well, it's wonderful to be here, and good morning, Queensland. Very good news today. We have only one new case overnight, locally acquired, linked with the Sunnybank cluster, so it's a household contact. And Dr. Lynn McKinlay will just talk a bit more about that case, but it was a day 14 test. So what that shows, it is so important when people are isolating, they do their full 14 days and do all those tests. We thank the family. We know this is difficult to get a test for a result like this right at the end of your quarantine period, but we are so grateful for all those families at St Thomas More and the daycare centre for all the great work they've been doing. Now we've got 19 active cases. We've had 9,729 tests in the last 24 hours, and we've had 22,336 vaccines. So well done, Queenslanders, for continuing to come out and get vaccinated. Also, we're here in front of the Priceline Pharmacy here at Kipwing Village because it is World Pharmacist Day. So thank you to all of our pharmacists who do such an incredible job. And we've got so many pharmacists working in our vaccination centres and in our hospitals as well, mixing up the vaccines and making sure that it is prepared for everyone. So thank you. Happy World Pharmacist Day, everyone. We are here with Matilda and Andrew, who are brother and sister who run this pharmacy behind me. But can I say their grandmother started this back in 1972, and their grandmother still comes and does some shifts here. So what a legacy. Well done to the family. And this pharmacy is now stocking Moderna. And that's what we want to let everyone know, that our community pharmacies not only have AstraZeneca now, but many of them are getting Moderna in. Matilda and Andrew have told me they did 10 yesterday. It only arrived yesterday. They've done 5 this morning already. So please come forward, go to your pharmacies, go to your GPs, or you can walk into any one of our community hubs that are open this weekend without a booking and get vaccinated. So whether it's Boondall, whether it's the Brisbane Convention Exhibition Centre, Logan Entertainment Centre, or any of our metropolitan sites, you can walk in this weekend and get a vaccination. Don't wait, come out and get vaccinated. Our current figures now is 62.8% first doses in Queensland, 43.96% second doses, and 4.5 million doses have now been administered in Queensland. So again, that is a fantastic number, but let's keep it going. We have an amazing weekend ahead of us. We have the NRL finals today. We saw a great game last night. More finals today, and of course the grand final next weekend at Suncorp. We also have the Wallabies playing in Townsville. Tonight we have Riverfire as well. There is no other state or territory on the entire east coast of Australia that can hold events like this right now. And we are so fortunate to have the lifestyle we have and have the virus under control, but of course we need to keep coming out and getting tested and get vaccinated as soon as possible. Now, we've also announced with the Commonwealth, we've agreed to set aside another $70 million as part of the $600 million support package to go to large and small businesses. $30 million will go to Queensland's iconic tourism attractions. So our big attractions that attract interstate arrivals, so our theme parks, but also our Great Barrier Reef attractions. People from Western Australia, South Australia, Tasmania, Northern Territory, of course, are still able to come here without quarantining and holiday. So we want to attract these people. So $30 million will go towards that, and $40 million is going to small and medium tourism businesses that were able to get the initial hardship program. So this is the second round of grants. If you were eligible and received a grant in the first round, you will be eligible for the second round. That's $15,000, $25,000 or $50,000 for small, medium and large businesses in the tourism and hospitality sector who would actually experience a reduction of turnover of at least 70% over 7 consecutive days between 1 July and 30 September. So if you need any information on that, you can go to the Department of Transport, Innovation and Sport website and find out more. But this is great news. It's great news to support our tourism sector, our iconic tourism attractions and small, medium and large businesses, and we welcome this joint agreement between the Commonwealth and State to set aside another $70 million to support businesses in Queensland. So enjoy all these amazing events over the weekend. I'll ask Dr. McKinlay to talk a little bit about this new case, and then we'll hear from Matilda about what our pharmacy's doing and the Moderna rollout. So, Doctor.
Thank you, Minister. As Minister mentioned, there's been one new case. It's a young child who's part of the Sunnybank Delta cluster. And that child was detected right at the end at 14 days. Now that does unfortunately mean that that family will have to continue in quarantine. And so I would like to thank that family and all the families who've been involved. What we know is that by staying home, by staying in quarantine, they've kept many, many people safe. And over 2,000 people were part of that group who had to stay home with their families. So we're very grateful that they did that and thank them. That was how many contacts there were. That child was a young child, had not been infectious in the community at all. Okay, is that better?
Yeah.
Sorry. Okay, so do you want me to repeat something? Okay, right, thank you. In terms of the vaccine rollout, I think last weekend we saw that was going so well with the opportunity for walk-ins, and we had a really terrific response last weekend. So we're going to be continuing the walk-in opportunity for Queenslanders, and that's at the Queensland Health sites, but also many pharmacies and other sites. So please check the website for that. Moderna did arrive this week, and I think we had 1,600 doses in the first 4 days or something like that. So it's going really well, and many pharmacies now have got that as well. In terms of the Queensland Health mass vaccination centres, there's a couple of opportunities this weekend. There are pop-up vaccination centres at the NRL preliminary final tonight. There are 2 sites there, so that's exciting for people who might want to take that opportunity to go to Suncorp Stadium, and there's one on the north side and one on the south side of the stadium. We've also extended the hours for the Brisbane Convention Centre for vaccinations this evening until 8 p.m. So if people are going down to South Bank to go to Riverfire, they'll be able to go to the Brisbane Convention Centre and walk in and get a vaccination as well. As I mentioned, the Moderna is here. There's already 106 locations, but that will be getting more as more stock arrives as well. I think that's all for me.
We at Priceline Pharmacy, Kippering, are very excited to get the Moderna vaccination. It arrived yesterday afternoon, and within 10 minutes we had people walking through the door to get vaccinated. There's a lot of people out there who may have been hesitant to get the AZ and couldn't get their hands on a Pfizer vaccination. So hopefully with the Moderna we'll see a lot more Queenslanders getting vaccinated.
Minister, can I ask, there are still thousands of Queenslanders stuck in the state who are not yet started hotel quarantine rooms. When can they expect to come back?
Well, we're working through that as quickly as possible, and I do remind people that if you are travelling interstate, we have been saying since June that people need to be aware of the rules. We have been saying since mid-June, if you travel interstate, there is a risk that there will be lockdowns, that there will be restrictions, and that if you do come back you have to fly, and that you have to go into hotel quarantine. So I appreciate that people are eager to come back, but many of these people have actually gone interstate knowing what the rules were. So for those who have been granted the right to come back but then decided they don't want to fly, then they're just going to have to be patient. We understand the heartache disruption that COVID has caused across the country. There are many families in Victoria who live suburbs away from each other who aren't allowed to visit each other. There are people in New South Wales who are not allowed to go from one area to another to visit households. So it's not just about Queensland and people not being able to come to Queensland to visit. This disruption is happening all over the country. And I'll say this again, let's also remember the over 260 people who have died since the 16th of June. These are loved ones as well, who have died without a loved one by their side, who have had to have a healthcare worker, who have had to stand by and try to pass on loved ones' messages of goodbye. This is heartbreaking. The numbers that stick in my head are the numbers of deaths I hear every day, the number of positive cases. We've had around 50,000 positive cases out of that one initial case on the 16th of June in New South Wales. That has now affected New South Wales, Victoria, ACT and New Zealand. So we can't be complacent. We understand people's frustration, but just like Australians been trying to come back to Australia for 19 months now and have had to wait till there is capacity, we are asking people who are stuck interstate to work with us while we try to build capacity. Now, we have already found some alternate arrangements, such as boarding school students coming back and being able to hotel quarantine, but we have to manage the risk. Today's case is another example. Here's a household, day 14, that's tested positive. So it is not low risk, it is a real risk that people are losing their lives. So we have to keep this in mind in every decision that we make.
So some of those people, you said that they travel interstate knowing the risk, but some of them travel interstate with an exemption before the border closed up on August 25. Why can't they come back and claim quarantine like the people have done so as soon as they can stop?
Yes, but people who have travelled since June also know there is a risk of the rules changing because of the level of risk and restrictions in place. Just as those towns along the Queensland border. The reality is every given week, we don't know whether New South Wales are going to lock down a town, whether it's Lismore, whether it's Tweed, whether it's Byron Bay. We never know on any given day if we're going to wake up and New South Wales are going to announce a new case that requires those towns to lock down. So we're very much in the hands of other jurisdictions as well. It's not so much we've shut the border as these other states have made decisions to actually lock down their own communities, and our decisions are reflecting that. But we have to keep the community safe. We can't have thousands of people all just coming home and going into home quarantine without looking at the risk factors, because if we did, it would be extremely irresponsible of us to do that.
So the press release, joint press release on the government grant Prime Code that says governments must also hold up their end of the bargain and stick to the plan agreed at National Cabinet. It will see borders open up as we reach vaccination quotas of 70 and 80%. Does that mean that borders will open at 70 and 80%?
Well, what the national plan says, and it's based on the Doherty modelling, is you can't just look at the percentage. You've also got to look at the number of cases, whether you are able to identify, test, contact trace and quarantine. If you haven't got those things under control, simply hitting the 80% mark isn't going to be enough. Now, I've just seen reports today that Singapore is now saying, despite having their community, their population 80% fully vaccinated, they are going back into working from home, school students learning from home, limited restrictions and movements in the community. This is Singapore at 80%. So if we talk about the 80% and the 70% mark, we have to also look at what the other issues are that the Doherty Institute talks about. Because New South Wales is already over 80% first doses, but you don't see them operating at the same level as what Queensland is. I think what is interesting is we have not heard from New South Wales, ACT and Victoria. When do they expect their jurisdictions to get to the same low restrictions that Queensland's got? Because we haven't seen that. We keep hearing about their roadmaps. Their roadmaps do not tell the people of Australia when do they expect to have the same low level of restrictions that Queensland has.
Based on where Queensland is at the moment in terms of the double dose, do you think, say, if we were aiming for 90%, in terms of where we'd be at 90%, that would suggest probably next year that would be at 90%?
Oh, look, us getting to 90% depends on supply from the Commonwealth. My concerns about supply is we've been able to pull all these extra doses from other countries, but it's on an arrangement that we give away some of our vaccines in November and December. So it's not that we've got extra supply overall, we're giving some back. Now, if we haven't hit those 80% targets by November and we're giving actual doses of Pfizer away to other countries, I think Scott Morrison's going to have to explain whether there's going to be enough vaccine in the country to meet those targets. But can I be clear? The Premier and Dr Young has mentioned the 90%. We want to see as many Queenslanders take up the highest rate of vaccination as we can. We talk about those rates because Queenslanders already immunised their children at 95% rate. So if as parents we're willing to vaccinate our own children at 95% rate, why wouldn't we want to see our adult population the same rate? That doesn't mean it has to be directly linked to restrictions. I'm just saying, why would we stop at 80%? Surely we want to do as best we can and get as many people vaccinated. Because the more people are vaccinated, the more we reduce the risk of these people ending up in hospital and sadly on ventilators or dying.
So you're saying the target is higher?
Sorry?
So you're saying the target is much higher than 80%?
No, I'm saying we'd love to see more. Let's not twist the words of the Premier. The Premier is not saying it has to be 90%. The Premier and Dr Young has said, let's do as many people as we can. Let's get the numbers far higher. Because do we really want to say, oh, we've hit 80%, it's all good? That means 1/5 of our population is unvaccinated and possibly infected in the community. So all I'm saying is we shouldn't just aim for 80%. Of course, we should keep going beyond 80% and get as many people in Australia vaccinated as possible.
Minister, are you concerned that we won't have the other aspects of control that would allow us to open it into things such as the contact tracing and things like that? Are you worried that we won't
We certainly have. We've done very well for 19 months now. We've been able to test, contact trace and isolate. And we have done that exceptionally well. I would argue we've probably led the country in our response in that way. Every major outbreak we have had, we have contained it. No other jurisdiction has been able to get a cluster like we had with the Indooroopilly cluster under control in an 8-day lockdown. No other jurisdiction. New South Wales is now 3 months into their lockdown and their cluster is over 45,000 positive cases and over 160 people dead. And I think, 260. And now Victoria's numbers just keep growing. So we've done remarkably well, but the Doherty Institute modelling that is there for everyone to see clearly says you have to be able to manage those things if you want to open up and reduce restrictions.
Minister, if we're leading the country in those areas, wouldn't that then indicate that we're capable of opening at 80% because we're doing those things so well?
But you have to also weigh that up against you're letting the infection into the community. You are saying we're happy for 20% of the population to be exposed to a massive outbreak, as opposed to we're opening up the state in relation to other jurisdictions that all have it under control. There's a huge difference between opening up when everyone else has it under control and opening it up to say we're happy for New South Wales cluster to come across our borders and risk infecting 20% of our population that are unvaccinated.
But what you're saying essentially is not when we get to 80%, all of them, those other things under control, it's when every other state
No,
is doing things.
let's be clear. I am not saying anything different to the national plan. I am not saying anything different to the Doherty Institute modelling. So can we be clear on the reporting on this? The targets are exactly what they are in the national plan. The National Cabinet is continuing to see new modelling come through, and it is National Cabinet that will decide what the restrictions will be and when we lift borders and all of those sorts of things. So Queensland is not saying anything different, and anyone who reports that Queensland's saying something different isn't reporting accurately. We are working with National Cabinet, and that's what we're doing. What I'm saying is the reports that says this is simply about hitting an 80% target is actually not looking at the modelling.
So there are 600,000 Indian-born Australians. Some of them feel a bit disappointed with the previous comments. Was she wrong with the question?
Look, I saw those comments this morning. The Premier in no way was targeting any individual ethnicity or culture. What the Premier is saying is Scott Morrison, when he talks about opening up international borders and having travel, needs to say which countries does he think the virus is not still spreading in, that we can have that travel bubble. Because there are many countries, I just mentioned Singapore. I'm not attacking Singaporeans, I'm not attacking a culture, or ethnicity. What I am saying is there are many, many countries that are still going into lockdowns, that still have restrictions, that I am interested to hear what the federal government thinks are the countries that we can visit safely and not have the virus coming back and forth until we get those vaccination rates higher.
Minister, I'm also a bit confused by, I guess the opening targeted, looking for sort of a more clear answer. What would you say to them in terms of trying to understand all the messages from the government and what they're saying about when they're open? What's the thing you can say to Queensland?
The National Plan and what the National Cabinet's agreed to is all available on public websites. The Doherty Institute modelling is all publicly available. Any changes to that or any new work that's being done is subject to consideration by National Cabinet. The Premier has said time and time again that they're still getting more modelling based on the numbers they've got, the changes. We're constantly seeing changing. We are constantly seeing news from overseas about being able to vaccinate younger children. All of that changes. All of that constantly changes the modelling. So if we can vaccinate younger children, great. That means more protection for more of our community. So the National Plan is what it is. It's up on the public website. The Premier has made it clear. Any changes to that, any additional work will be discussed at a National Cabinet level. But what I do want is to stop seeing reporting that somehow Premier and Queensland here is somehow going it alone and making up different rules, because that's just not correct. We are simply trying to make sure that all the facts are out there.
So you're saying we aren't listening to the national plan?
The Premier has said that all of this will be discussed at National Cabinet. She has said that time and time again. Thank you. Yes.
That's good news for Queensland.
Fantastic.
How do you feel knowing it's back, and any advice for Redcliffe?
So River Fire, just make sure you're looking at the websites. There's areas that you can go. Please wear your masks. Make sure that you social distance, but please come out and enjoy the lifestyle that we have. It is so great that we are having these huge events happening in our community again. It's great for tourism, it's great for business. Come out, support these events, but make sure you're checking the websites and aware of what the rules are and where you can be standing and watching the fireworks tonight. But it is a beautiful day out there, and it's going to be a beautiful evening for fireworks and hopefully some pretty good footy finals as well. Thanks.